Well, let me add my welcome along with the others that will speak shortly. We want to have these to keep you as updated as possible, and we want you to be informed to the extent possible about all of the plans we have for the safest return possible as we bring more of our employees and then our students back to campus. I want you also to know that our plans are based on data-driven decisions informed by our infectious disease and medical experts, our public health, epidemiology experts, our informatics, health informatics, and IT and digital strategy. So we're using all of our strengths and all of our tools to inform this plan, which we believe will help us be as safe as possible. As you know, early on, very early, we were one of the organizations that went to the limited business model because first and foremost, we have always put the health and safety of our employees, our faculty, our students, and our community first. But we've been able to make progress on a number of fronts, and there are challenges that remain. We've got at any one time 85 to 100 COVID patients in the hospital now, which is among our highest levels. It doesn't overwhelm our capacity, but as you'll hear later, we are trying to do as much as we can to bring our clinical activities back to normal, albeit many of our ambulatory appointments have been via telehealth, video conferencing. And that will continue to some extent. You submitted a lot of questions, and we're going to try to answer those as clearly as possible. This is an evolving situation. This virus will be with us. It's not going away anytime soon. So we've got to use face masks and social distancing, good hand hygiene, and other measures to make sure we don't spread it among ourselves. Most of the employees who have been infected to date have gotten it in the community and not at work, but there are a few exceptions to that in the healthcare arena. We want to thank you for really stepping up and doing everything needed to help us pursue our most important and vital mission. With that, I think I'll turn it over.
And Reed Jones, CEO of UAB Health System, is next.
Okay, thank you very much. First of all, I'd like to take a minute to express my sincere appreciation and gratitude for everything that you've done to take care of our patients during these unprecedented times. Particularly those of you there on the front line, you truly are heroes, and I want to say thank you. As you know, a few months ago, we made the very difficult decision to reduce compensation within UAB Medicine for our staff and faculty. When we looked at the numbers that we were projecting in the March and April timeframes, we really were faced with losses that were just unsustainable, and had they continued, it would really put in jeopardy our ability to continue to provide care. But as the months have moved on, those numbers have improved dramatically. The hard work that you guys have done helping us bring the patients back has just been enormous, and we've received about $100 million in federal money to help us get through this crisis. So I believe all saw a communication that we sent out last week saying that we're going to be able to restore those cuts effective July 1. And we're also going to be able to go back to May when they were first put into effect and restore and reimburse those reductions for everyone other than just our seniors staff, our management team. We're going to be looking as the fiscal year unfolds at the reduction in retirement, and hopefully, although we won't be able to make that decision until the end of the year, but hopefully if things could continue, we will be able to make the decision to restore there later next year. Unfortunately, we're seeing COVID cases increase. As of midnight last night, we had 89 patients in the hospital, and I believe the number was even up higher this morning. So we're certainly not out of the woods yet. That having been said, we're just about back to our pre-COVID levels in terms of volume. We had 4,253 discharges for the month of June compared to 4,367 last June. Our surgeries are almost back to the pre-COVID level, 313 3,000 versus, 3,013 versus 3,047 last June. As Dr. Watts mentioned, we're seeing our ambulatory visits come back to close to pre-COVID levels, but about 40% of those are done through telehealth. But at least we're able to get to the patients and provide the care that they need. We don't know what the future holds. If the volumes continue to increase, we've got to carefully manage that. We're certainly not in the position that we were back in the March and April timeframe. We have our systems working now where we're better able to cohort patients and make sure that we are properly protecting our employees, our physicians, and all from COVID as best we can. But you know, we're watching it closely, and there have been a number of questions about what might happen this fall. Our hope is that we can continue to see our non-COVID patients as well as treat the COVID patients if we need to. We still have a lot of employees that are working from home, and we hope that we'll be able to continue that. Really, you know, across the country, business has really made a big change in terms of how we deploy our workforce, and many people are able to work from home, work productively, and we hope to continue that even as we get back to our normal levels of operation. But there are a lot of issues we've got to deal with there. How do we keep you guys connected to the organization, to your supervisors, and to your fellow employees? So certainly something that we're going to be dealing with over the next several months. So in summary, we've seen our patient volume come back to near normal level, but we're not out of the woods yet. We're managing things very closely, and our goal is first and foremost to take care of our patients and to keep our physicians, our faculty, and our staff safe. So with that, I'll turn it over to Dr. Benoit.
Thank you. Welcome. I'm so glad that you could join us this afternoon. I want to start by saying how proud I am of how resilient and flexible and creative all of you have been during this crisis. I know that you're anxious, that you feel stressed. This comes from a variety of different factors: working remotely, taking care of children, when camps aren't available during the summer, what will happen with K through 12 in the fall, taking care of other family members. So there are a lot of stressors on you, and I would say I feel them too, but we are trying very hard to develop plans that keep our community safe, but also continue to advance the mission of the university. So first of all, I want to talk just a little bit about what we're doing for academics. We're in the process right now of completing the measurements of classrooms so that we can appropriately socially distance in our classrooms with the collaboration of facilities. And we are assigning and identifying what type of class each class that we're offering in the fall will be. And there are 4 possibilities here. It may be an in-person class. It may be a class that's hybrid that involves a combination of in-person and remote activities. It might be a remote class, or it might be an online class. And each of those are now in the process of being identified and placed into the schedule so that students understand what type of course they're electing into. UAB has one of the most comprehensive health and safety programs in the country for universities. It includes a variety of elements that others today will talk about, including required mask wearing, social distancing, the use of health check to monitor symptoms, Sentinel testing, exposure notification. And then one last element I'll talk about just briefly is a command incident committee who's monitoring on a very regular basis the spread of COVID in our community. At UAB, regionally, within the county, we're looking to see what the cases are, where there are outbreaks of this. In addition, that group will be developing a dashboard, and we're working right now on completing the data feeds into that dashboard so that we can monitor that very carefully and identifying factors that might cause us to make a change of action as a result of the information we're gathering on the health front. So those are some of the plans that are in place. Anupam, do you want to add more about those?
Thank you, Dr. Benoit. I just wanted to provide an update on where we were in our efforts in terms of mitigating COVID-19 and keeping our campus safe. Towards that end, as Dr. Benoit just mentioned, we have started a Sentinel testing program for faculty, staff, as well as for students. We had the first run of it last week. So essentially what we do is invite randomly about 4% of the population of faculty, staff, employees hoping that at least 2.5% of them would respond and get the random Sentinel testing done. The testing involves a nasal swab. It's not that more invasive nasopharyngeal swab, and it can be done at multiple locations on campus, at Highlands, at Kirkland Clinic, at our Gardendale or Hoover or Leeds location as well. The samples are collected. They are self-administered under observation of a healthcare technician. And these samples are run by our infectious disease colleagues in a lab with a turnaround of within 24 to 48 hours. If the result is positive, the employee gets a phone call from employee health. If it's negative, you will get an email towards that effect. So to tell you, last week, about 600 notifications were sent out. We had 146 take up the offer to get the randomized test done. Of the 600, there were 192 from campus, and about the remaining 400 were from UAB medicine employees and staff. And there was only one positive from the 146. So that was very encouraging. And this one person actually had an exposure, so we knew that clearly that was going to be positive. So that process is continuing. Another 600 or so emails went out on Sunday. We would encourage you to please take advantage of this opportunity if you are selected in the randomization process, that if you are coming back to work, to at least have this test done. We will continue this. In addition, we've added a hotspot testing as of today from employee health, where in the hospital and other areas where we think there may be significant exposure risk, that we would offer hotspot testing throughout the day. The employee can go to Kirkland Clinic or one of these locations and have testing done. So again, the safety of our employee is of most significant concern to all of us. And by offering this testing capability, it adds to the health check as well as the contact tracing that would occur. We are also, as I mentioned last week at the town hall for faculty, beginning a higher ed testing for all students coming back into our 16 public institutions in the state of Alabama, as well as about 14 private institutions. So all about 250,000 plus students will be tested at least 10 to 14 days before entry through multiple locations, about 15 locations across the state that would be set up, where you'll have drive-through testing sites, and the test results, hopefully within 48 hours, that would be offered back to the participant. So these are some of the measures we have implemented going forward to try and limit the spread of COVID-19, to make sure we can test cases if they are positive, and then quarantine those cases, and then also extend the testing to folks that the people have come in contact with. I'll stop here and pass it on to Dr. Sarah Knapziger if she wants to elaborate on some of the points I made. Sarah?
Thank you, Dr. Agarwal. I'm the medical director for employee health, and when you fill out your health check every day or so, if you fill a positive answer on there, then you get passed off to employee health, and that's where our team takes over. So we do manage all of your testing and work restrictions related to COVID-19, and we're with you all along the way if we need to do any contact tracing or hotspot testing in specific areas of campus, and that includes both campus and UAB medicine. We do abide by ADPH guidelines from the Alabama Department of Public Health, and those guidelines have changed several times along the way, so we do keep up with that. And as they change in the future, which they're likely to, we'll be keeping up with that and making sure that we abide by all the latest guidelines from our public health authorities. So, you know, nobody likes to be sick, and this situation's been tough for a lot of our employees. I know a lot of us are very worried. We want to make sure that we remain healthy, and so that is definitely at the top of our concern list for employee health. But the good news is there's two things that I want to say to you. The first is that the protective measures we put in place do seem to be effective. If you do the masking, if you social distance, if you're careful with hand washing, all these measures seem to be very effective at preventing the spread of this disease. And the second thing is, if you do get sick, and we know some people are, then we're going to be here with you along the way. Employee health is going to be with you to help you get tested, to help you manage your illness, and to get you help if you need further care. With that, I'll stop and turn things over to Alan Bolton.
Okay, good afternoon. I'm UAB's Senior Vice President for Finance and Administration, and I'd like to add my thanks to you for joining this virtual town hall today, and also for sending many questions in advance. Our collective prepared remarks are aimed at addressing many of those questions, and I'll continue with that theme. My comments will be centered around our financial status with the campus, and I'll be reinforcing some of what you heard from Dr. Benoit about our reentry processes. So for fiscal 2020, which is our budget year that ends on September 30th, the campus is tracking very close to the bottom line financial performance that we predicted when we revised our budget outlook back in April. Among the individual line item assumptions that we made back then, we've had a mix of pleasant and unpleasant changes. For example, summer enrollment is stronger than we predicted, but our budgeted investment income is weaker than we predicted. Our Federal CARES Act, or the stimulus funding, was substantially more than originally anticipated for our health system, but on the campus side, it was very close to the budget that we estimated. The end result for the campus is that we continue to close the budget gap that we estimated with the countermeasures that all the units across the campus are participating in. Our efforts, such as the hiring freeze, the suspension of non-essential travel, our utility savings, which have been significant, and overall expense reductions are working. That means that the institutional furlough plan that impacted 328 employees will end as planned on July 31st. Most of those employees will enter the phased reentry planning process that many of us have already participated in, and they'll receive return to work instructions accordingly. For next fiscal year, the campus is preparing its budget later than usual due to our need to get better projections on enrollment and research funding data. This week, we will push information out to the campus units. Central units will need to submit their budgets by July 24th and schools by August 8th. So those dates have not been posted yet, so you are hearing it here first. Individual schools may establish earlier deadlines in order to roll their budgets up for our institutional deadline. The current financial outlook for fiscal 21 is an essentially flat budget, which in the midst of this pandemic, I consider to be good news. State funding will be slightly better. Tuition funding will be slightly lower. Research funding will be slightly better, and auxiliary funding will be moderately lower. And importantly, our cost to prepare and maintain COVID-related safety precautions on campus will be a significant new cost for the university. This means that we will most likely carry forward many of our existing expense reduction strategies, such as ongoing suspension of non-essential travel, continuation of the hiring freeze with its exception process, and other unit-level operating expense reductions. We are not planning for a merit increase program in next year's budget as well. There were a few questions that were submitted about parking on campus, and specifically about whether we would reimburse parking rates for people working remotely. I'll reinforce what I've mentioned in the past, that parking and transportation are a core part of the university infrastructure, and the vast majority of our costs for parking are fixed. Things such as land, technology, and our safety expenses to provide for those lots. Therefore, we don't have plans to reimburse monthly parking assessments for employees who continue to receive a paycheck. Of course, the employees who were furloughed were not assessed for parking during their time away without pay. Finally, much has been asked about how we are planning reentry and how we are monitoring the safety of going forward. Dr. Benoit addressed this in part as well, but I want to reiterate that we have two representative task forces that are working really tirelessly on those critical efforts. Our reentry planning and implementation task force is chaired by Dean Lori McMahon, and they are focused on all planning and implementation matters for the campus. And our new COVID Incident Command Center is chaired by Katie Crenshaw, and they are focused on monitoring how safely we are reentering and helping to calibrate both community and campus data to influence our reentry decisions and practices. So I'll end my prepared remarks there, and I think turn it back over to Rosie for the Q&A. Thank you.
Thank you. Just a couple of housekeeping notes. We are recording this session. It should be available on UAB's YouTube channel later. And any questions that go unanswered, we collect and we send out to leadership and get those questions answered. And so look out in your next kind of e-reporter, an upcoming e-reporter, unanswered questions will be answered. So many of you sent in questions yesterday, so we're gonna start off with some of those questions. Several of you are asking about PPE, access to PPE, and so for both faculty and students, but I'll kick that over to maybe Pam can talk about faculty resources first, and then maybe over to Alicia or Greg about staff.
So for faculty, the university will be providing 2 cloth masks to each faculty member, as well as 2 face shields for them to use in their classrooms. We'll also be providing in that welcome back bag a couple of disposable masks, so that if you have students who attend class and have forgotten their mask or left it in their car, you'll have a disposable mask to offer them when they come into class. So those are the kinds of PPE that we're providing out to faculty. Students are also going to be provided with 2 cloth masks on their reentry.
Okay. Alicia, did you want to address anything for staff?
I didn't know if Greg or Stephanie would be better prepared to address that.
The other thing I would add to Dr. Benoit's remarks is we're providing large quantity bulk hand sanitizer refill stations. So if people have their personal hand sanitizer products with them, there will be stationed out 100 to 200 different large refill stations so that people can refill their hand sanitizer.
One additional
Rosie, I can just share that we're working on a distribution plan to get those masks to students and to faculty. And we had a meeting last week where we were considering perhaps using Bartow Arena. We haven't decided on that yet, but we're working on a plan where individuals can come and pick up their masks. And so as soon as we have that plan in place, we will make sure we share that.
All right, so sticking with the
Rosie, real quick, I'm sorry, one point of clarification. There will also be 2 fabric masks provided to each staff employee as well. So faculty, students, and staff.
Thank you.
Great, thank you. So people want to know about where will the supplies come for cleaning their own workspaces and work areas. So I'll pass that over to Greg.
Thank you. We're working with procurement to obtain bulk wipe dispensers that will be located in access to classrooms. The research areas have already begun using spray bottles of alcohol and paper towels. Those are being provided. Beyond those are the primary distributed supplies that will be made available in addition to the individual's supply of hand sanitizer.
Greg, can you also comment on cleaning of spaces in offices?
Right, we expect with the need to clean the public spaces more frequently, we're going to deploy staff to address those public spaces more often, which means that we will not be coming in individual offices. It will be the individual faculty member or staff member responsibility to take care of their own workstation, and a number of reasons for that. So if there are things like trash pickup, we'll have instructions on the website for putting your trash outside the office for pickup or taking it to the nearest collection location. Roughly monthly vacuuming of offices as opposed to weekly. And I think that's the way we would address individual workspaces.
An individual asked, during reentry, what precautions or options will be in place for employees who are at higher risk for contracting the virus? Older employees or those who are immunocompromised? Want to pass that over to Dr. Benoit, Lori, Dr. McMahon?
Or maybe Alicia Jones.
I think Alicia might be best for that one.
All right, Alicia.
Hi, we are working through our AWARE program, which is the disability management program that has been in place for several years to help manage those concerns. And there is a process as you go through the reentry training, the awareness training, where you can request an accommodation. And if you need an accommodation that's outside, after you've completed the training, you can request that through the HR website, through the AWARE program. I know one question's been asked around the timing. How long does it take? It really depends on the situation. If it's a situation where there's a need to gather medical data or get something submitted from a physician, it may take longer than those that can be addressed without that type of information or the time it takes to get it. So it really depends on the situation. Also, as it relates to the AWARE program and as we're managing these types of situations related to accommodations, there have been questions around privacy. Well, this program has always been managed appropriately with in compliance with all the regulatory requirements for safety and security of data. And so that is also the same with this during this time of COVID and these associated requests. So that's how you should address it. And again, no concerns about the data, and it's being managed in a very secure format.
Staying on the HR front, Alicia, people are asking about if they are able to take FMLA for COVID-related family issues.
If they are approved through the FMLA process, then yes. And so they should apply for FMLA through the process that exists for that leave. And if it's granted, then they would be able to take that.
An individual asked, when is UAB medicine support staff application development coming back to the office? So I'll pass that over to Reed, maybe. You're muted, Reed.
Would you repeat the question, please?
When is UAB medicine support staff coming back to the office?
Well, by support staff, if you mean the people that are working, for example, in the business office and finance and that sort of thing, we have a task force in place that's addressing exactly how we return to work. We wanted to make sure that as people come in, they come in a very safe way, observing all the social distancing and masking requirements and that sort of thing. It's our hope that a number of these people can actually work from home, and we're going to accommodate that and try to make that happen as well.
So a more general question for campus side, when do we anticipate employees being able to return to work 5 days a week? So maybe that's a Alicia or Alan question.
We're monitoring the data, so I would say to be determined. I know Dr. McMahon's task force and Ms. Crenshaw's Incident Command Center are helping us develop the data that we'll monitor. We are having a good amount of success with a lot of remote working, so we're pleased for that to continue while we navigate the way the virus is moving through our community.
And I also add that we've asked each unit to develop their own reentry plans. So this will not necessarily be the same for every single unit on campus. And so as they develop those, they have included some timelines around when people would return. It might not be 5 days a week. It might be an alternating schedule. There are a variety of ways in which we can try to accomplish our social distancing guidelines. But if you have a specific question, I would recommend that you talk to your supervisor about the plan for your particular unit.
So several of you have asked about the contact tracing app, which is the COVID notification tool, and it was supposed to be rolled out a month ago, and it hasn't been implemented yet. Could someone give us an update? So I'll pass that on to Dr. Carver.
Yes, this is Dr. Carver. We had actually a meeting with Apple and Google this morning, and we're continuing to work on the exposure notification app. We're in the final stages. We will go into alpha testing this week, beta testing next week. Apple and Google during beta testing will do a code review to ensure privacy and security of the data. And at that point, we'll publish. So it'll be in the next couple of weeks before we release. Apple and Google confirmed we'll either be the first or second state in the nation to release. So it kind of highlights UAB's commitment to the safety of its students and employees.
Okay, so continuing with some of the IT questions, will UAB have adequate internet service for students living off campus in case of service interruptions at their home? Will there be a quiet place for students to connect to internet and adequate service to view lectures and to take tests? People have reported interruptions this past summer, so I'll pass that on to Dr. Benoit and Dr. Carver.
Oh, Kurt, why don't you start and then I'll add on.
Sure. So the Governor Ivey has formed a task force to look at this specific issue and to see if there are mechanisms that we can do to improve it. As many of you know, UAB was at the forefront by opening a parking lot for students to do drive-in Wi-Fi. We're exploring doing that with additional parking lots. We then also developed an app that provides statewide where there's drive-in Wi-Fi. We're partnering with the city of Birmingham and Jefferson County to identify public library parking lots that can be used in that regard, and then to try to address the underlying and systemic issue of bandwidth off campus. On campus, we have the fastest network in the state. We are looking to expand and create quiet spaces with enhanced bandwidth to support students having a place where they can come on campus, be in a safe environment, have adequate bandwidth, and be able to participate and in remote classes outside the classroom. Dr. Benoit, I'll pass it over to you.
You said what I would have. The only other thing I'll add is that for those students who will be in the residence halls, we will have adequate bandwidth in the residence halls to accommodate those students who need to have that. But for off-campus students, Dr. Carver's response is spot on.
Okay. Many of you actually sent in questions related to diversity, so I wanted to give Dr. Paulette Dilworth a chance to talk and address what we are doing on our campus. Like one person talked about, how do we get our white counterparts to come out there in a comfort zone and to acknowledge that their Black coworkers are deeply hurting? You're muted, Paulette.
Thank you. Thank you for the question. Well, for starts, we've been working very hard in the office to organize a series of webinars beginning in the fall. One of our themes that will run throughout that session will include issues and conversations about race and racism. We've also started a program, thanks to Emily and Susan Cohen, where we've started 2 reading groups that's sort of a spinoff from our Talk Matters. And primarily the way that works is that there are books that will be used. This group is using the book Why Are All the Black Kids Sitting Together in the Cafeteria to as a framework to start those discussions. But let me just say too that UAB is well positioned to address these issues. I think that we are way ahead of the game when it comes to some of the programming that we've been doing in the past and some of the programming that we will continue to do. One of the things that I would encourage you to do is to reach out to us to make suggestions about programming or activities or speakers that you would like to hear that you think might help us to elevate the conversations and the voices of all of our people. We want people to be engaged around these issues and feel comfortable doing so. So with that, I would stop here.
And there's just a few follow-up questions there about what is UAB doing to address pay disparities in the realm of race?
Well, I think I'll kick that question over to Alicia. What I would say is that I understand that we have not studied pay disparities to determine where they exist and are they concentrated in certain areas or certain job classifications, certain parts of campus. So the first thing would be that would need to happen to determine where those exist, and then we would have to develop plans on how they would be addressed.
Thank you. So now we're going to turn to parking. We've had several parking questions come in. So Andre, is there a schedule for campus parking garages currently shared with UAB Medicine to resume normal badge entry as campus employees return to work?
Thank you, Rosie. We have actually started converting some of our decks back to our pre-COVID normal conditions. We've converted the Fifth Avenue deck, the Kirkland Clinic deck, the administration building deck are now back in normal operation along with a few select lots. We are evaluating those other decks now, and we will slowly start to transition those decks back to normal. Notifications will go out to all permit holders who are assigned to those facilities to let them know about our progress.
And then another specific question, when will the 19th Street deck be returned to being for those parkers only?
Again, we're monitoring that. We're analyzing that deck. That deck is temporarily being used by UAB Medicine employees as well, but we have not had any capacity issues to date. So we want to make sure we address it prior to getting to those capacity issues, but right now we're okay.
Okay, great. Several people have submitted questions asking about if we're testing students, why are we not testing ourselves as faculty and staff? So Dr. Agarwal or Dr. Nafziger?
Yeah, I'm happy to take that question, Rosie. So for now, we are doing Sentinel testing for faculty and staff. And our hope is by August, when all faculty start coming back, that we would consider offering that to all faculty and staff as well. At least that's in the plans, more details to come. So Sarah, do you want to add anything to that?
Yes, thank you. And I would like to add that any staff or faculty member who is symptomatic, any employee, we have a very low threshold to test. So if you report any symptom consistent with COVID, we are testing individuals at this point in time. And then also offering testing for high-risk exposures, but that is very directed by employee health at this time. So you can't just say, hey, I had an exposure, I want to test. Right now, that's being directed by employee health based on risk stratification using tools that we've adapted from ADPH and the CDC and using our contact tracing methodology. So we do have a significant amount of employee testing going on right now, but it is not universal reentry testing at this point in time. That's all I have.
To continue on the testing questions, I was randomly chosen to volunteer for the testing, but the email stated I should not participate if I'm working remotely. I would like to participate, but I'm still currently working remotely. May I still volunteer for testing? Sarah?
Yes. If you're working remotely, we're not restricting you from participating in the Sentinel testing. You're certainly more than welcome to participate. It's not required, of course. And then also people who are working remotely, if you have symptoms, you're also, we would like for you to access employee health for testing if you're symptomatic as well. So we do want to provide those services and be there for our employees, whether you're working on campus or whether you're working remotely.
And Dr. Agarwal, could you talk about the accuracy of Sentinel testing? How accurate is it?
So the accuracy of Sentinel testing is quite high. In fact, the false negative rate is less than 5%. So essentially, if you have 1,000 people tested, it'll miss 1.5 persons. So really highly specific and sensitive from that regard. We validated, currently we are doing individual testing, but just expecting the large volume. The lab is also validating pooling of maybe 2 to 3 samples at a given time. And all the validation that done just this past week, the accuracy has been 100%. So for example, if one of the tests is positive amongst the three, the pooled approach actually will pick that up and will necessitate us going back and testing each of those three individually again. It just helps us do more testing. Right now we have manageable numbers, but going forward, if the numbers increase significantly, it'll allow us to do that volume. The supplies is also a critical need for the testing. It's not just the kits, but the supplies necessary to run the tests could also become a limiting factor. They are not right now, but if they become a limiting factor, we are trying to validate this pooling method as well. And Sarah may want to comment on that.
What I can add to that is just that through the Sentinel process, testing process so far, the positives that we have picked up have not been terribly surprising. There are people that had some high risk exposures. So we do think that it's been fairly accurate to this point. And then to add to that, our traditional PCR testing methodology is extraordinarily sensitive compared to other methodologies we've looked at. So we've been very pleased overall with the accuracy of testing at UAB in general.
If we have an employee test positive, are the people working in their immediate area required to report an exposure and be tested? Dr. Knapsinger.
Yeah, I'll take that one as well. So if we have an employee who tests positive, part of the process that happens after that is one of our employee health physicians, which is either an infectious disease expert or someone with additional, who's board certified in another specialty, but has extensive infectious diseases training in addition to that. So one of these physicians is calling that person and counseling them about their health status, and then also initiating contact tracing. And by that, we mean we talk to them about all the exposures that they may have had in the workplace. And we use the risk stratification tools from the CDC to determine if they've had any high risk exposures. Each situation is different, so there's no one guidance that we can say applies to every situation. We look at them all individually, and then we determine based on that history if there are individuals that need to be notified, if there are individuals that need to be tested based on that information that we gather. In addition to that, we also notify the supervisor of the positive employee, so that that's another layer of protection where we can find out if there are others who've been exposed that we might need to know about.
Great, thank you. When will masks be available for people who are already working on campus? I'll pass that to Stephanie.
So the large order of masks are scheduled to be delivered prior to August 1st, and then we will distribute those as Dr. McMahon mentioned earlier. However, I would say that departments, as they have been working through their individual reentry programs, have been working with procurement to obtain masks as well. So if there is an area who does not have masks, if you will reach out to, you can reach out to myself. We'll get you to the right area to find out if we can help you get some masks.
And Stephanie, do you know if UAB is accepting donations of homemade cloth masks?
I don't believe we have accepted those donations for use for the medical team, but I'll let Reed or Dr. Arderwall or someone weigh in if they think differently.
Reed, this is Sarah. I can answer that one if you like.
Sure.
UAB Medicine has accepted cloth mask donations for distribution to support persons who may arrive with patients, or for patients who may arrive without a mask, but we have not used them for our healthcare providers. So I hope that answers that question. If anyone does have someone who's willing to donate masks, I know we've had several civic organizations who have done so. We are still accepting those, but like I said, we're not using them for our healthcare providers. It's for patients or for their caregivers that might be here with them as required.
Is there a point person or a website we can point people to that may want to donate masks? Do we know?
I don't know the answer to that right offhand.
Okay, we'll get that information and do a follow-up. So how does the hiring freeze affect student employees or incoming work study students? Will we not be able to hire new student workers? So I'll give that to Stephanie, I think.
So Alicia, you may want to weigh in on this.
And I think in our exception process, it says that students are excluded. So it should not affect students' work studies or student employees at all.
And I'll just add that we really want to provide those opportunities for our students. Many of them count on work study to help support themselves. And so we already have many ideas for work study students that can help us with managing our reentry and working with classrooms and things like that.
Someone is asking, will UAB ever address hazardous pay for specialty personnel as the Jefferson County has recently done? So maybe that's for Reed or for Alan.
We're not looking at hazard pay specifically. We are instituting some pay differentials for individuals in certain areas, but it's not hazard pay. It's basically trying to keep up with the market and make sure that we can appropriately recruit and retain employees.
Great.
And I would say the same is true on the campus side as well.
Okay. And then somebody was asking about donations, and Tom Brannon just messaged me. So I'm going to give you the floor, Tom, because we are taking donations, different kinds of donations, if you want to talk a little bit about the efforts that your office has been doing.
Absolutely. We've had a lot of support from our campus community, employees, students, but also the city of Birmingham and beyond for several funds. And one of those is the PPE fund. You can go to help.uab.edu/fightcovid19/ and there it shows all the funds we have. We have an employee support fund, a student support fund, our research fund that has raised over $1.1 million to go toward our research efforts around COVID-19. But then again, also a PPE where you can donate the equipment itself, but you can also donate money for us to help purchase the PPE equipment.
Great, thank you. Heather Holmes just submitted, what are the parameters being used to decide if fall will be held on campus? Is there a plan in place to swiftly close campus if an outbreak occurs on campus in the fall? So I'll pass that over to maybe Katie Crenshaw and Laurie McMahon. Katie.
Thanks, Rosie. Yes, as Mr. Bolton and Dr. Benoit mentioned, UAB has formed an incident command committee that is monitoring data both in the community and on campus in terms of our effectiveness in implementing all of the strategies you've heard today to promote health and safety on campus. And you know, that information from the committee is going to senior leadership to pace return and approve operational plans, as someone else mentioned. There's not one specific metric that the committee can point to, but we're using all of the total circumstances to help advise senior leadership. Lori, would you have anything to add to that?
Sure. I will just add that the hybrid teaching model will allow us to change direction if that is needed. And so that was one of the decision-making points when we decided to introduce the hybrid teaching model. So many of our courses are in that model, and that will allow us to easily pivot and go fully remote if that need should arise.
Okay. Dr. Irwin submitted a question. What is the time by which employees would be notified if they've been exposed to a positive case in a fellow employee? In other words, once an employee has tested positive and contact tracing has begun, when should potentially exposed employees hear from employee health? Dr. Nafziger.
Thanks for asking. So there are two mechanisms by which people might be notified of an exposure. If there's a high risk exposure, then that employee most likely would be notified directly from employee health, although sometimes that notification might come through the supervisor depending on timing and exactly the time that we get to the notification process. The second way is when an employee tests positive, all situations such as this, the supervisor is notified of the employee who tests positive. And if there are no high-risk exposures identified, then other employees will not necessarily be notified of those. Only when there's high-risk exposures that are identified.
Okay. Individual is asking, will units be able to invite people from outside the university to campus for public presentations this fall? That might be Dr. McMahon or Dr. Benoit or Katie.
Thanks. That's a really great question. We are limiting outside visitors to our campus in an effort to keep everyone safe. Many programs have been delivering seminars through Zoom meetings, and we are requiring or are suggesting that continue for the fall. That provides opportunities for our students and our faculty to engage outside researchers and visiting scholars in a safe way through Zoom.
There's been several questions about merit. Will merit happen this year? And one individual talks about if merit's been built into a budget, a grant budget, would you not receive it? So Alicia or?
I can go. This is Alan. I'll go ahead and just reinforce what I had mentioned earlier. We are not planning to proceed with a merit plan for the university in the upcoming budget year.
Okay. A couple of individuals would like to know about health check, more clarification on how it works. And then maybe Sarah, if you could explain this and talk about how when you get to employee health, there's an additional form.
Sure. So Health Check is a website that basically you start with and collect some basic information, and then periodically you check in with it. And what they're asking is, hey, have you had any high-risk exposures, and have you had any symptoms of COVID-19? And if you check yes to any one of those, you're immediately referred to employee health and into our portal of entry for employee health. So I will caution you that a lot of folks have asked, hey, one of the questions is, do you have muscle pain? And yeah, I have a pain in my back that's always there. So I went ahead and checked yes. And it flags you for work restrictions because you reported a COVID symptom. So I would caution all the employees that what we're really looking for, if you read that page, it's asking for new symptoms and something that is new or different for you. So once you're flagged and referred over to the employee health portal of entry, it's a completely separate database, a separate computer system, and this is all focused on employee management. And one central tenet of this is that we are doing everything we can to protect your privacy as an employee. This is more of a healthcare type relationship where we're managing your private personal data and taking care of your individual health. So that is why it goes into a separate system, is for that very reason, so that we can make sure we respect that. And then at that point in time, we gather some more information and determine if testing is indicated, and you're referred for scheduling for testing at that point.
Great. I would just like to add that we are required to fill out health check every 3 days, and you will be alerted by email every 3 days asking you to respond to health check. If you don't respond and within about 6 hours, you will receive a text message reminding you. But the first message that you will receive is by email. And that will continue if you don't respond in 3 days at 6 days. And then if you don't respond after that, you will not get further responses. So many staff and faculty and students have been confused about why they aren't receiving health check reminders. You will only receive reminders through the first 6 days. So make sure you respond every 3 days when you're asked.
Well, and at day 7, it will become into HR. And then we start managing it as an HR issue from the standpoint of non-compliance with health check. And so, but what I will also remind everyone is that there is a COVID awareness training that everyone who was either already on site working or have returned to campus in one of the reentry phases has access to. And once you do that reentry training, it directs you to if there is a workplace accommodation, like I mentioned earlier, because of a high risk category that creates a concern. And then it takes you into health check. And that's a place where you can sign in for health check and begin taking health check there. And then that becomes one of the ways that we monitor the training that's been completed, that is an awareness about how we want everyone to maintain safety while they're here on campus, and as well as when they're not on campus, and also health check. And so those are some of the data points that we will track and we will report to the command center on a frequent basis. Also, what's critically important that is happening at the department and the unit level is the maintenance of an HR database. In that HR database, it flags if any faculty and staff member is assigned to work on site, work remotely, or work in some hybrid fashion where they may be on site some and working remotely some. It also tracks their building location. And so that information is critically important to keep up to date and keep accurate, because then there again, it helps us in being able to identify, as Dr. Nafziger said, if someone tests positive, to know who else is in that location and who else maybe is not necessarily in that close proximity, but maybe who else is working on that floor or working in that building. So keeping all of that information up to date is also critically important, because all of these pieces tie together to help us make sure that all of the parts that we've put in place to ensure the safety of all of our faculty and staff are working together and working properly.
If I could add just one more thing about the health check. It's possible to do it daily. Some people find it easier to do it daily. You're required to do it every 3 days, but I would also say that if you have a change in symptoms, you should definitely go ahead and report that even before the 3-day period is up.
And I'll just add one more thing too. Sorry, Rosie. It's really easy to find health check if you have the UAB app downloaded on your phone. There's a tile for UAB health check. And so all you have to do is hit that tile and it'll take you right there. That you were probably going to share that, weren't you, Rosie?
I was, but that's so great that you did it. So yeah, it's easily accessed on the UAB app. So we encourage you to download that. Well, we just have a couple of minutes, so closing remarks, and I'll pass it on to Dr. Benoit, and then we'll hand it over to Dr. Watts.
So I just want to reiterate again, thank you for everything that you've done. We know that you're working really hard to make sure that we accomplish our mission, and you can see from all the planning that you heard about today, we're working hard to keep you safe.
I would echo that, and I hope that this openness and transparency is helpful, because the more you know, the better we can work together for a safe campus. And I think also the questions that may not have been addressed will be addressed, and they will be put onto the website in the near future. The communications team will work on those. And there are a lot of them, so it may take some days or so, but we hope to answer all of your questions. There are still uncertainties, but we have to make plans as though we're going to bring our students back as of 8/24 and start classes. There's a lot of infection out there. We're watching it very carefully. All of our people are watching it very carefully. So we'll put all that into the decision-making process. In the meantime, thank you for all you're doing. Really has made all of us proud of UAB and the great mission we have, and taking care of people and also taking care of one another. That's important. So we'll sign off for now, but glad to have you here today, and we're going to keep informing you. We'll have some more of these as we go forward. Thank you. Bye-bye.